ask my staff, either David or Eduardo, to let me know if there are questions in the chat. Questions or other concerns? I invite everyone to write in the chat box their contact information, their program name, and other, maybe a link to their program, so that gets recorded in the chat and attendees can go back to that and capture that information. So it's 9 o'clock. Let's begin. This is Brenda Lee Rodriguez. Welcome to our Chula Vista Community Collaborative Partners meeting the month of September. And we're celebrating the kickoff of the Hispanic Heritage Month. And here with my Puerto Rico mug. If you don't know it yet, I'm from Puerto Rico and I share that Latinidad with many of you. So the agenda for today, as you know, these calls are recorded, and by the end of the week, most likely we will have loaded the recording and all the flyers and slide presentations that you will see today and even more. We welcome you today. We're still accepting the people that are coming in. Thank you. And we will have some updates from several organizations. I will ask you for some feedback and we'll provide several updates. Also, some presentation. We have a short lineup of presenters and we'll discuss updates from every one of you that wish to do so, whether on the call or on the chat. Remember to say your greeting, your name, email address, or any way to contact you on the chat box. And our next meeting will be in October the 12th. So for those of you who are joining us for the first time, this is the Chula Vista Community Collaborative monthly call, and we are focusing on the healthy community and the well-being of Chula Vista residents. We do so through our family resource centers. We are open, even though that school is, may be on break, we are open to service our communities and our 5 family resource centers. And as I indicated, this is the Hispanic Heritage Month, and I'm very proud to lead a team that is linguistically and culturally competent to serve our 90% of our clients who are Latino or the Hispanic origin. And as many of you may know, this month was signed by President Reagan at the time, and it's a celebration of all the advocacy, the culture, the roots, the contributions and achievements of the Latinos in the United States. And this month in particular, because many countries in Central and South America celebrate their Independence Days or national holidays. We're still inviting people and admitting them in the lobby. Thank you. Since last time we met in August, there has been a lot of work on digital literacy, not only of my staff, but also helping clients get more comfortable with this shift in the pandemic mode from in-person, in writing, paperwork, faxes, to online world, applications, developing profiles, getting comfortable with the actual software and using the functions, especially to communicate and stay in touch with their loved ones, and even to manage their healthcare issues. So we have partnered, kudos to our San Diego Futures Collaborative, San Diego Futures Foundation partner who has assist us with the technical assistance, with the actual skills development activities and sessions for our programmatic voluntary staff, and those are the promotoras active in the community, led by our promotora Azucena Lopez de Nava. We have continued to expand our list of collaborator agencies, and we are needing to work on flexibility of scheduling or of planning, because this is kind of the new norm, as many of you can attest. And we're very excited to join NALEO, the National Association for Latin Elected Officials, in their Juntos Podemos campaign. Yes, this campaign runs from August till October, and we will be using their logos and their materials already developed by professional marketers and cultural experts, targeting African American and Latinos over 18 years old. Oh, we're still admitting people. Thank you. Thank you for joining us today. We're just getting started and talking about the many accomplishments we have done since last we met in August. Also, I wanted to share with you, some organizations were there. I recognize some of your names on the September 8th recognition from the San Diego County to all the promotores that have been working very hard, educating the community, educating themselves first, so they can dispel misinformation and provide accurate information regarding the COVID vaccine, testing, and so forth. So as part of the Live Well San Diego initiative, 4 of our promotores were celebrated and will receive a certificate of appreciation. So I congratulate the other organizations as well, and you can see the logos very faintly. These are some screen captures that I did trying to capture that moment. So Aida Mesa, Eduardo Castro, Gabriela Ruano, and Lily Hernandez are promotores here. And a special shout out to our youth ambassador, Eduardo Castro, who's also helping us with our social media and all the IT stuff. Much needed help. Thank you for those of you who are just joining. We have some updates from the Institute of Public Strategies, and Jovita Arellano sent us the information about the Chula Vista Garden Club, inviting us to attend their kickoff event. More information is there, and also to contact Jovita for more details. Again, I invite attendees to write their name in the chat box, contact information, and updates of your programs. Let me touch base with my staff. Do we have any questions or items from the chat box? Not yet? Admitting more people into the lobby. That's great. So we have more updates. We're training, we're actually disseminating important training opportunities for high demand occupations. And these are health related careers. And for more information, we have Connie de la Fuente here. Connie, would you want to share some updates on these opportunities?
Yes, absolutely. Hello, everyone. Good morning. Thank you so much, Brenda Lee, for welcoming and for having me at this meeting. I just want to share with you that we have, I don't know, do you have that slide that I sent you? Do you have this slide with that you can share, Brenda Lee, with the information?
I have this one here. I'm sorry.
Okay. Anyhow, I think what you're seeing, okay, for some reason I'm not seeing it on my screen, but that's okay. I just want to remind everyone that right now the San Diego College of Continuing Education, where serves adult learning and adult students, is enrolling. And there are a lot of great courses that you can take. There is high in demand occupations that pay really well, and we have short trainings. Some of them, for instance, is if you or some of the clients that you serve are interested in the health careers, there is a health careers course that starts in September 7th, which passed, but there's another one coming up in November 15th and January 3rd. And they're able to learn about all the different types of health occupations that we have in the health sector. We have over 38 health occupations, and I think people, when they think about the health sector, they primarily think of nurses or doctors, but in fact, we have over 38 careers. So that would be a great course for either you, if you're interested, or for your clients to understand a little bit more of what opportunities are in this sector. Also, we have medical terminology. A lot of our community health workers, promotores, are trying to help our communities translate or get services. And I think it would be great for them to refresh their medical terminology and probably acquire that skill. And that is very much needed in the health sector at this time. And we have the personal and home care aid. The personal and home care aid is a really growing and great in demand sector because, as you probably are aware, the aging population is continuing to increase. And so there's going to be more and more people needing home health care individuals at their home. And also we have continuing education. These continuing education courses are for acute care, behavioral health, home health aid, restorative nurse assistant. And the beauty out of these courses, as many of them are online, so you can take it from the comfort of your home. And I encourage everyone to continue with your personal development and professional development. And thank you so much, Brenda Lee. If you have any questions, I will go ahead and put my email address. But I also wanted to let you know that if you want to enroll, you go to sdce.edu/help. And I will also go ahead and put that information in the chat box. Thank you.
Yes, and for everybody to know that all these slides and the flyers that the speakers had sent us, it will be all put together in a package that you can download by the end of the week, most likely, from our webpage on partners. Thank you. I'm glad that we were able to include those updates on these opportunities for training on high demand occupations. Let me confirm, can attendees see my slide? I need a verbal confirmation on the updates.
Yes.
Yes.
Fantastic. So here I do want to test the waters a little bit and get your feedback. So far, because of the pandemic, we have had all virtual meetings. And I know that there was a big tradition of having them in person before under the last leadership. And of course, prior to the pandemic, when it was then shifted to virtual format. We had anticipated being able to meet in person at least quarterly for a meet and greet and after the summer. But now, given that the current situation, I just want to test the waters and your feedback and see what other organizations are doing. I wanted to check with you and give me feedback on for the continuation of our monthly meetings on a virtual format. And I will invite you to give me feedback right now. If you want to type that in the chat, yes, virtual or in person, please include that in the chat and also verbally. I want to hear from you. Any considerations?
This is Thomas with the CWS. I know that for us, we go according with the county, and right now a lot of our social workers and our office are open with limited capacity, so we're not at full, even though we are first responding and we're going out in the field and conducting looking into our investigations and referrals and things like that. The office itself is still kind of on that virtual, everything is done virtually. So I do recommend for us, probably we kind of became like experts at Teams and these virtual meetings through this pandemic. So I'm okay with continuing virtually too.
Thank you for that.
Yeah, and our lobby is open with, you know, our requirement is that when families do come in, like they are required to wear masks. Uh, there are, there's also limited space too. So like, when there are signs posted at our office and, on, the corner of, Third and H, when they're coming in to make sure to ask and to wait until they're being assisted. So.
Yes, thank you for that feedback. We are having those same challenges in our family resource centers and still with all the protections in place for safeguarding the safety of staff and visitors, we do keep. But in terms of the collaborative, I think that based on the feedback on the chat, and it's the safest will be to continue with our virtual meetings and put a pin on the meet and greet. Any other comments on that topic?
Yeah, hi, it's Carol Crisp. Nice to see everybody. I just wanted to say for us, you know, we've been virtual as well, but even going forward, I think even a hybrid method might be really an awesome thing to do because we all have so many meetings. And for me, I've been able to attend more meetings virtually than I was in person because of, you know, getting out to different things. So if you had the option eventually, I don't know if that's something others have considered, but I thought that would be a good option for everyone to have a hybrid version of this. So in the future.
Yes, Carol, thank you for that. We have thought of something into the hybrid mode, and implemented some tests with our own staff meetings. We also were thinking for the collaborative because of the higher number to have a in-person meet and greet. So
Yeah.
not necessarily all the presentations, not the formality, but just really to make that physical connection and being in the same room with others, business card exchange and talking informally. And that I think we are going to put a pin on that in person for the next couple of months based on the Delta surges. But definitely we want to go back to that in-person interaction at some point. Yes, more feedback. And by popular demand, as Manuel wrote in the chat, virtual. Okay, I think that there's consensus here as we are caretakers as well as workers. I think Corina Soto mentioned that. Yes, given this feedback, it's important for us to set precedent and show support for all the other initiatives that are holding and keeping with the virtual setup. So I think that is on that topic, we have reached consensus. So eventually we will do the meet and greet and we'll continue to test the waters and see what the guidelines are. Coming up in the next quarter too, we have the holiday support opportunities for Chula Vista families. And last year when I arrived, even within the pandemic, we really were not looking at big numbers. We really were looking at quality and safety. And we were still able to provide Thanksgiving dinners and do the Santa Shop and Adopt a Family program with our Chula Vista resident families. And once you get the slides, you can click on that link on the screen because it's kind of just fond memories of those events. And we will welcome the involvement of some of your organizations if you want to donate gift cards, if you want to donate food, if you want to donate toys, clothing, art supplies, anything that will enhance the holiday experience for these families at the end of the year. And if you're interested in adopting a family and learn more about that as an organization or as a department within an organization, or even as an individual member in your own family, you can adopt. We put together a profile of a number of families protecting their identity first, but a profile indicating, their situation, the sizes of clothes of the children, certain preferences or needs for them, that it will, obtaining those things will be a great deal and will mean a lot for these families. And then we set up an opportunity for either virtual meeting like we did last year or distance, a socially distant meeting in which then those families receive those items of support for the holiday. So if you're interested in any way able to support, interested to know more and how to become involved, let me know. Do we have any questions on the chat? Let me go before our speakers. Let me see the chat. Okay, I think I don't see any more comments on that. Remember, for those who just arrived, please write your name, organization, and way to contact you in the chat box. Attendees can always go back to the chat and dig that out and connect with you. So without further ado, let's go to our speakers today. Let me see, more people joining. It's never too late to join, right? And our first speaker today will be Azucena Lopez de Nava, our promotora coordinator. Then we'll have Daniel Ramirez from San Isidro Health, and then we have Manuel Andrade with a lot of updates on that program. So, Azucena, are you there?
Yes. Good morning. Good morning, Brenda Lee. Good morning, everybody. My name is Azucena Lopez de Nava, Promotora Coordinator for the Chula Vista Community Collaborative. And we are very excited to offer this amazing workshop. Es difícil ser mujer, or in English, is difficult to be a woman. This is a peer support program to prevent depression. We are bilingual promotoras, and we are certified facilitators. And at this time, we're going to do it in virtual mode. We used to do it in person, but in this time, we're presenting in virtual mode in Teams. All the information are in the flyer, and we're going to start very, very soon in October. It's going to be 7 weeks, but this workshop is directed for the Hispanic community. It's going to be in Spanish. Let me know if you have any questions, because we're just start enrolling, and the space is going to be full very soon.
Yes, and Azucena can type her email address in the chat box. And this program is conceptualized to assist the families in the Chula Vista Elementary School District and the Sweetwater High School District. But we do a pre-screening, given that it's going to be done in virtual mode. So we want to do that digital literacy assessment for the participants. Can you tell us more, Azucena, about the questions that you asked for participants?
Yes, of course. So we ask them, the family members, if they're living in the city of Chula Vista, if they have an access to internet, if now we can help them to assist them in that. If they have a phone, an iPad, or computer, and for some reason, if they're not, some people are new, in this Zoom and Teams. And if you have any questions, we can help you. We can help you to go through, and then you can connect it. So the steps are, you just register with, you send me an email or a phone call, and then after you fill it out and information by phone or in person, you can come up to the office and pick up a material for the workshop. And after that, we're done. If you have any question, we can help you. The most important to go through the digital information.
Yeah. Thank you, Susana. And I have here one raised hand. Let me see. Thomas, do you have a question?
Yes, this is a good opportunity. It's a possible because we do work with Chula Vista school districts too in South. Is there a way that we can get a copy of the flyer, and then so that we are also promoting that too when we're meeting with families? I know that for us on our end, mental health has been an increase due to the pandemic. And there are a lot of kids who are experiencing a lot of the mental health piece where the parents aren't equipped just because they don't understand. So we're doing a lot of referrals to NAMI and to things just to get that support. But a lot of time, we do have a large Spanish-speaking population where, we feel that it's hard to get to them too because they don't view mental health as they're thinking is like, my kid will get out of it, it's just something that they're going through, it's the school, it's the they don't have that capacity. But to have something for them, so I think if you could email me a copy of the flyer, and then I could also provide it to our social worker to get, if they're working with Chula Vista students, because that's the priority, right? The Chula Vista kids who are attending Chula Vista schools within the district. So I'll make sure that the Chula Vista units will get those flyers and promote that too.
Yes, Thomas, this particular mental health support program is for the mothers. This is for the mothers for them feel more empowered and knowing more about recognizing those early signs of depression and being able to cope with emotions. I think Azucena go through several skill set and empowerment techniques, so the mothers are really be able to manage those feelings and are able to provide that support to their children and family members. Right, Azucena?
Yes, Brenda Lee.
Are we going to have dads, just because I advocate for dads as much as I advocate for moms, because working in this field, I've also experienced there are dads that need the same services too, and there are a lot of single dads out there. So I just want to make sure that they have an opportunity also too. So.
Yes, certainly. And if any of the attendees know about programs that especially target fathers or male Latinos, or not on any particular ethnicity, please bring those up to our attention, and we will be glad to share that. This particular education program and peer support program was developed in Mexico with evidence-based data to back it up, a 6-week program that Azucena is certified as a facilitator along with our stellar promotora, Gabriela Ruano. So as a culturally sensitive and linguistically competent program, it is aimed at mothers at this time. So thank you, Thomas, for raising that. And Azucena, who wrote the email address in the chat, will be able, if you just send her an email, she can forward the flyers that we have. And also remember that for everything that you see and hear today, we're going to upload by the end of the week the slides and related flyers. So you will also get it that way. If you want it quicker, contact Azucena via email in the chat.
Okay. Is there a deadline for enrollment on this one?
reaching capacity, but we will still get the names of interested parties to do a waiting list, because then we will kind of stack them up until the end of the year with different cohorts.
Okay. Awesome. Thank you.
Yes, in virtual mode, we have reduced the number to be more manageable, and it's about between 10 to 12 per cohort. Okay, so let me continue sharing, and thank you, Susana, for that. We do have a lovely video, a 90-second video of that, and you can go to our ChulavistaCC.org and take a look, as Susana is telling us more about this program in that short 90-second video. So after Azucena, we will then have, Daniel, are you here to tell us more about San Isidro Health vaccination pop-up efforts?
Hey, Brenda Lee, I am here. Good morning, everyone. Can you hear me okay?
Yes, let's find your
Okay.
PowerPoint. Let it is here. Can you see it on my screen?
Yeah.
Okay, you'd let me know.
Perfect. Good morning, everyone. My name is Daniel Ramirez. I'm a program manager in the research and health promotion at San Isidro Health. I oversee some of the research and health education programs, as well as our mobile vaccine clinics out in the community. In this presentation, I'll give you guys a little bit more background on our setup that we have out in the community and the efforts that we have for continuing vaccinating the community, which we all know the job is not done. And possible collaborative efforts that maybe we could team up and make a greater impact in our community. Next slide. So the mission of San Isidro Health is to improve the health and well-being of the communities we serve with access for all. For many of you that know San Isidro Health, we offer an array of comprehensive services, anything from medical to dental to behavioral health, and support services as well. So we have case management, social workers, we have health education, and also some research programs where I work under for that team for the research department. Next slide. So the history of San Isidro Health, and I'll give you a little bit of background. Originally established along the border in 1969 by our founding mothers, which were 7 women in search of medical services for their children. The name and brand identity pay homage to the humble beginnings in the community. When San Isidro community was named in honor of the San Isidro Labrador, or Saint Isidore, the patron saint of farmers, day laborers, and the working poor. San Isidro spent his life as a hired hand and always shared what little he had, even meals with people in need. Next slide. More background on San Isidro Health. So San Isidro Health is a nonprofit, federally qualified health center committed to providing high quality, compassionate, and accessible health care for the entire family, and being also a leading safety net provider for critically primary care services and the second largest community health center network in San Diego County, providing through a vast, innovative, and integrative network of 47 clinics and programs. And that's something that we've been working on lately, is expanding the services. Just I think the most recent clinic opened was in Julian, so we do have a new small clinic in Julian right there with the famous apple pies. I already went to go see the clinic, but it didn't hurt that there was some apple pies right there as well. In Campo, Escondido, El Cajon, and anywhere from south to north to the east region of San Diego County. Next slide, please. And before I jump into the mobile vaccine efforts, I did want to point out that these are our locations. I can share these slides as well with this group. And all clinic locations do offer all COVID vaccines. So that's a Pfizer, Moderna, or the J&J as well. But throughout the presentation, I'll focus on our mobile vaccine clinics. Next slide, please. So the vaccination with care, that's what we like to call our vaccine efforts out in the community. We're not just providing the vaccine and that's it. We're also connecting patients, we're also connecting community members with care, with reliable information, with resources as part of that. So what we've been able to integrate within the mobile clinics is screenings and linkages to care. So that includes blood pressure, glucose, and provider follow-ups and referrals. We do have at times health educators and care coordinators that are out in the field with us connecting patients with care. We are also joined by HIV testing. I would say 95% of the time that we're out, we have an HIV team who is offering on the spot, on site HIV testing and Hep C testing for those who qualify. We do also have health promotion as well. So we'll set up another booth for health promotion where we can provide PPE kits. And we know just how important these PPE kits are still in this day, and also how for some families and for some communities can be a bit difficult to obtain certain PPE materials such as hand sanitizer, masks, disinfectants, but we also provide the digital thermometers and the oximeters. So if someone is exposed or if someone is monitoring at home, we do give them those tools to do so because we know it's not they're not cheap, right? A lot of these equipments and supplies are $20-$30, and that can really be a big impact for a family. So we do, as much as we can, provide these. Also, hygiene buckets. We've been able to partner with some of our health home services and patient engagement programs where they'll join us and they'll provide hygiene buckets that include disposable or one-time toothbrushes, soaps, cloths, body washes, and disinfectants as well for the community. And that one was a really big impact, and I'll share later on the downtown. We served the downtown and unsheltered population back in July, and we were providing socks and shirts and soaps and everything. So you could see the need in the different communities, and we tried to adapt our services to the communities and the needs that we're serving at that point. Next slide, please. This is our workflow and the model for our vaccination efforts. Very similar to what you would see in a clinical setting. We do have the pre-registration, which is screenings for everyone that stops by our booths and stops by our vaccinations. We do offer, provide a COVID screening, so signs, symptoms, temperature check. Then at that point, we give them the paperwork, consents, the FAQs for the vaccines they're taking. And then the vaccination takes part. For the most part, out in the community, we do offer Pfizer and J&J. We have both at all times, unless a partner or a location specifically asks for the Moderna, then we could provide it at that point. But we've seen that the Pfizer and J&J are the most requested by the community members. We also have a partnership with UC San Diego, which is called the Tu Vida program. And that program is to, again, address any hesitancies, barriers, concerns that the community might have, but also connecting community members to the vaccine and increasing that vaccine uptake within the community. So on the events, we have the Tu Vida team from UC San Diego who administer as part of the program and as part of the study is not only to provide the vaccines, but also the research perspective of offering and inviting patients, community members, to take part in a 10 to 15 minute survey to get a little bit more insight of what's going on in the community, in particular where we're at, and if there's anything that we can develop for future materials, future presentations to address. So we do have that, and that happens during the observation area, which is perfect. They have to be there for 15 minutes. So a lot of them, it's like, I'm already here, it doesn't hurt to take part in this survey. And after that, after the observation, they're ready to go. We have the HRV, we have health promotion, we have the PPE kits, and the patient engagement. So it's this really streamlined flow that we've seen works very well in our community, because again, we're not just out there giving the vaccine and that's it, but we're also making sure that we take care of the whole person, that we're really making sure that we address the needs that we can at the moment. But if we can't do something there, then we can connect them to one of the clinics back nearest to their location. Next slide, please. So some partnerships that we've developed is through the San Diego Housing Commission. That was an event back in July. It was a series of 3 weeks, 6 total dates that we were in downtown serving the homeless and unsheltered population. We are also in Northgate. As you can see in the background, I'm in the mobile unit that I'll talk about in a bit. We are in the Northgate on University Avenue right now. So we have, we have a busy schedule. We're on Northgate on 43rd Avenue in National City area, and today we're on Northgate on 43rd. We also have a new partnership with Southwestern College where we're partnering with Southwestern College to vaccinate their students. We were there early August. We did 2 weeks for the first dose, and now we're returning this week and next week for the second dose. That's their first cohort, and we're doing a second cohort, a second set of students from October to November. Again, being there for the first dose and then returning again for the second dose. And that's our motto always for all locations that we can, is making sure that when we schedule that calendar that we're coming back for that second dose in the 3 weeks, because we primarily focus on Pfizer and J&J. J&J is only one, with the community. And if it's our last day being there, we make sure that during the time that they're receiving their first dose, that we let them know where the nearest clinic is at or where it's located, and also making sure that if they have a PCP, that they could also get their second dose with their PCP if we just happen to not be there for the second dose. Another big one that we have is the San Isidro Chamber of Commerce. We were able to confirm a partnership up until the end of the year where they're every Tuesday and Friday. Every Tuesday and Friday that we don't have a Northgate event at the San Isidro Chamber of Commerce, and that's really by the San Isidro border on San Isidro Boulevard. And we see there's tons of foot traffic. People are coming in and out from work to back to the house. And it's been a very successful site because we're catching community members on their way home, on their way to work. They don't have to stop by to a clinic, make line, wait for them to be called, see the provider or the nurse to give them the vaccine, and then the 15 minutes still, and then have to drive back. We're meeting at them where they work, where they shop, or where it's by parks or busy traffic, foot traffic by community members. We have a new partnership with Lincoln High School. We'll be there later this month and back in October to vaccinate the students, but also the family members of the students in that Lincoln and Morris community of schools within that area. We are also with trying to reach a lot of the churches. So we have a partnership with Encanto Southern Baptist Church that we were just there last week, and we'll be returning on the 30th, I believe, where we will also be partnering with one of the food drives events happening at that point. So hopefully a lot more people show up for we were told 200 to 300 people show up for the food drive. So we are hopeful that we get reach as many as we can during that event. And we were also for the South Bay Pride that happened last month. We were part of the South Bay Pride. We were invited, and we also vaccinated community members. So we're really wherever we can, wherever we can build partnerships with, we are definitely open to bringing the mobile unit. We have the mobile unit and we really started efforts July 7th. So really just over 2 months right now, and we've been able to vaccinate 430 community members or administer 430 vaccines at the community level. And again, we're not trying to vaccinate at the masses or vaccinate a lot of these community members. We really want to address certain barriers and certain concerns. So that can be childcare, transportation, so meeting community members where they're at. So that 430 is a very big accomplishment for us because that's 430 individuals that might not have otherwise been vaccinated at this point. So we're really trying to address those barriers that some community members might have. Next slide, please. This is through the Southwestern College. Being that it's a bigger event, we have a lot more students there that need to be vaccinated to take part in in-person activities. We've been blessed with partnerships and support. So we have the Filipino Doctors and Nurses Association volunteer with us on that event. We also had Southwestern College EMT students vaccinate for that event. So then they could also, for the students, it was a great experience because they're vaccinating their peers, they're vaccinating students. And it's a great feeling when you're working with your community. And again, these individuals or these students were just getting experience in vaccination and getting experience in a lot of these efforts. So it was good to kind of work with the Filipino Nursing Association and also with the EMT students at Southwestern. And that's still a partnership going on since we still have a lot of these Southwestern events happening in the future. Next slide, please.
2 more minutes.
I'll hurry up. So this is what our calendar looks like for September. We're still working on the October. So as you can see, it's pretty busy. We have the Southwestern College. We have the Chamber of Commerce. We have Northgate, the Encanto Church, and also an African American LGBTQ health and wellness event happening on the 25th, and the Lincoln High School happening on the 28th. So you know, busy, but we are open to more opportunities. Next slide, please. And here, just some pictures, some slides of what our setup looks like. In the middle, you can see the mobile unit. The mobile unit has been very key, very crucial for our efforts and the success, because we're not just a tent in the middle of our parking lot. We are bringing the clinic, that feeling of having a clinic, to the community. So a lot of people feel more comfortable approaching us, and also knowing that, you know, San Isidro is a trusted messenger within the community. So feeling that they can get care and that they are going to be taken care of. So we have at the bottom some of the COVID kits. The bottom right, we have the downtown event. With also on the bottom left are one of our providers being interviewed on Northgate's back to school event that we partnered with them. In the top left is our setup in the Southwestern College. That's the HIV and the health promotion booth right there. So you can see kind of what our setup looks like. And then we have the COVID resource centers that we established early in the pandemic. So if any community member needs help, linkages with care, COVID testing, vaccine, food pantries, we connect them with everything. We have health educators who are on the phone, ready to receive their call. And that is it. Really sorry for taking a little bit longer, but if there's some time for questions, I'll take. If not, then I'll be in the chat box answering anything, and I'll provide my email as well.
No, thank you so much, Daniel. I really think that this is a great opportunity to showcase not only your effort, but also allowing other organizations to know of these initiatives, and that they can contact you and San Isidro for other planning for in the incoming months. Here in the chat box, let me take a look. We have here, are the families receiving education about COVID vaccination? Are there concerns within the Latino communities about the vaccination?
Of course, I think a lot of concerns come with a lot of myths that they hear, a lot of misinformation that they might hear out in the community, you know, con los vecinos, with the family and Facebook. So we do have at every event a health educator who can address any questions and provide any education at that point. So yes, we're not just giving the vaccine, but providing that education as well.
Yeah, I think that is very important. Our group of promotores who are doing the wellness calls with the families of our students here, also as part of their script, they don't only talk about the vaccine, but they ask questions. They guide the families into where they can go, and also within the context of other needs. So they ask about chronic disease management. They ask about the impact that COVID has had in their families. If there are referrals to be made for food boxes, for other needs to be addressed, they do that. So I think that we share those philosophy of seeing that as one aspect in the general well-being of a family.
Yes, of course. And yeah, part of our efforts is also educating the community. So we do presentations with the health experts. So we have, you know, providers, doctors who are always helping with the presentations to answer concerns or questions at the community level. So that's also part of our efforts. It's that presentation and education.
Yes, and I can attest to that, that San Isidro health clinicians have come to our group of CRSs, community referral specialists and promotoras, in discussing in Spanish or in English the topic of the day as related to COVID testing, vaccination, or other related health concerns. So we thank you for that. San Isidro Health is one of the 9-member steering committee that governs the Chula Vista Community Collaborative. So you're always welcome to give us information and updates. And we thank you for putting in the chat your contact information, so every organization that wants to connect with you and maybe add more busyness to your calendar with the mobile clinic, that would be great. Thank you so much. And let me see, any other concerns from the chat? You are receiving a lot of kudos there, Danielle. So that's fantastic. Also, one from the previous conversation regarding depression, and this is from Virginia, telling us that depression is considered a disability and that visit please the Department of Rehabilitation to get vocational counseling at no cost. And she gives this cell phone number, the number and the address. So thank you, Virginia, for sharing that. And I think that Jovita, she joined us. I'm glad. We provided some information on your event coming up, Jovita. So hopefully you were able now to see the slides. Okay. Coming up, our next speaker is they're waiting patiently. And let me see if I do share again. Okay. And make it a presentation. We have Manuel Andrade, and with a very relevant and never out of fashion topic of combat tobacco use. So I'm very proud to have an ongoing conversation about this topic and all the updates related to any activities related to ending tobacco use in our communities. So Manuel, I'm checking the time, so the floor is yours.
All right. Okay. Good morning, everyone. It's so nice to see so many people that I haven't seen in a long time. Connie, Patty, Odin, Daniela. Good morning, everyone. Great to be here. My name is Manuel Andrade. I'm a senior community organizer with San Diego Social Advocates for Youth. Our program's name is San Diego Smoke-Free Project, and we do social change and policy change toward tobacco control issues. Today, we wanted to, we'll give you a little update about our work on ending the sale of all flavored tobacco products in the city of Chula Vista. These last 4 months, there has been a lot of activity. We formed the San Diego versus the Big Tobacco Coalition. And we're gonna go with that. Next slide, please. Our agenda, we have 4 points to go over today. One is, again, objectives on our coalition. We're going to provide some local data and national data and some background about what has been happening the last couple of years with the flavored tobacco product. As you know, we have an acute e-cigarette epidemic, not only in San Diego, but it's a nationwide problem. We're going to talk about a little bit about flavors, nicotine marketing, and health effects, and then ways you can get involved. The coalition is moving super fast, and we're planning to hopefully get these docketed in the Chula Vista Council by the end of this year. Next slide, please. I'm not only presenting, I'm so sorry. I'm presenting with my supervisor, Cynthia Knapp. Cynthia, if you want, please introduce yourself and then continue, please. Thank you.
Good morning. I'm not sure how my microphone's working. Manuel, can you hear me okay?
Yes, we can hear you. Just turn up your volume a little bit.
I actually don't know where my volume is on Teams, so I'm just going to scoot closer to where I think it is.
Yeah,
okay, good morning, everybody. I'm Cynthia Knapp. I work with Manuel at Say San Diego for the San Diego Smoke-Free Project. The San Diegans versus Big Tobacco is a coalition that was established in May of 2021. It was spearheaded by the Campaign for Tobacco-Free Kids with one really clear policy goal. We're looking to end the sale of all flavored tobacco products in the cities of Chula Vista and the city of San Diego. We'd like to strengthen the municipal codes in each city so that the local, the state, the federal tobacco retail policies are being enforced in a really robust way. And we're looking for a policy that's really comprehensive. We're looking for all flavors, from menthol to Milky Way. We're looking for all products, from shisha to vapes to cigarettes, like everything, and all locations, hookah lounges, corner markets, smoke shops, everything that sells tobacco products. We're looking to eliminate the flavored items from their shelves. So during the course of this presentation, we'll share why flavored tobacco is such a public health concern, especially in the city of Chula Vista. And then at the end, we'll provide meaningful ways for CVCC and your individual organizations to get involved with our goals. Manuel?
Thank you. Next slide, please. Some state and national data. Tobacco continues to be the first cause of preventable death in the U.S., with more than 480,000 people dying each year from smoking. From those, 50,000 people die from exposure to secondhand smoke, which is one of our main objectives, right? To reduce that secondhand smoke that kills so many people that never use a tobacco product. However, they died from that. Since 2000, high school smoking rates have dropped from 28% to less than 7% in California. That, these problem with e-cigarettes have reversed all these work in the last 30 years. We work with funds from Prop 99, and now we're seeing that usage goes up to 40%, like kids just using for the first time. And there's other categories that I'm going to share on some data coming up. We also see that 96% of high school kids in California vape flavors. That it's something that the industry has, found that marketing and flavors will hook kids with nicotine addiction. And there is a little edit here. There's some mistake here at the last point. Teens who vape are 5 to 7 more times more likely to get COVID-19. This is from the Stanford School of Medicine. And there's another study from Los Angeles School District that also says that teens who vape are 5 times more likely to start smoking tobacco, regular cigarettes. And that's, a no-brainer. It's the same product, right? The only difference is the smoke with the vape, but it's the same psychological addiction, the same physical addiction, and then the same platform where kids socialize and share with that. That's the cycle of addiction. Next slide, please.
Hey, Manuel?
Yes.
Our friend Chelsea was able to join. So let's take a moment and introduce Chelsea with the American Heart Association.
Thank you. And I'm so sorry, we're on a time crunch and we have another meeting, another presentation coming up. I'm like 1,000 miles per hour, and this is my 3rd coffee. So sorry if I'm a little too fast here. Chelsea Walczak from the American Heart Association. She's part of the coalition. She was supposed to present with us today, but sadly she had another presentation at 9:30 and she had to leave. But she's part of our presentation. And
I jumped back in from that meeting just because I did want to say hi to everyone, and I figured I would at least say for this background slide, but then I have to jump back again. But I appreciate being here, and it's wonderful to see you all. It has been a while, so Manuel, that was such a great sentiment when you said hi to everyone, because I was like, Brenda, I haven't seen you in so long. It's good to see you. But let me dive back in. So, some of you might be wondering, why are we talking about flavored tobacco? Didn't the state do something about this last year? And you're right. Last fall, actually almost a year ago, pretty close to the date we're actually getting, the state of California passed Senate Bill 793. We call it SB 793, which ended or restricted the sale of flavored tobacco for the state. We were very, very excited to see this legislation pass. It was estimated that it was going to save over 17,000 lives here in California and taxpayers almost $800 million in healthcare costs. It was a big win. Unfortunately, it was short-lived as the tobacco industry pushed hard to challenge the legislation and actually bring it to referendum and to vote. That'll happen in 2022. So in the meantime, we are working at doing this at a local level. We can't wait for the state to catch up. Really, there are so many lives, and really our kids' lives, that we have to look out for here. Early in 2020, before the pandemic even hit, Chula Vista City Council was actually requesting additional information to think about this kind of ban locally already. So Chula Vista was already ahead of the ball and thinking about, making sure that flavors weren't available to hook kids. So as a part of that additional information requested, a Chula Vista vaping and smoking survey was completed with Sweetwater Union High School District. 14 of the schools, they got over 2,400 responses from their high school students. And Manuel, I think you're going to jump into what actually showed really, really interesting data just from Chula Vista Youth.
Yes. Thank you, Chelsea. Thank you for joining us. So nice to see you back. Well, as Chelsea was saying, in 2021, from I think it was March and April, a student from San Diego State University, intern Ben Slater, did this survey trying to find out some more information about usage, awareness, perception of tobacco products with kids in high schools and junior high schools. And as we can see here, the first slide on the left says, how likely are you to use a non-flavored tobacco product? And I cannot, of course, see there's a bar here. And I don't see that. Hold on one second, please. Here you go. So we see that 65% of kids are not likely to use any flavored tobacco product. And then we see that 29% are not sure. And then we see that 6% that we were talking earlier, right? That they possibly or very likely will use a non-flavored tobacco product. This pie slide on the right asks, what products do you or your friends use? In terms of usage, kids use pens and puff bars for 68%. So those are flavor electronic devices, puff bars and pens. And then there's that Juul, which initiated this epidemic using at 23%. Now Juul, they FDA prohibited them to sell flavored tobacco products last year, and then we see this reduction. Next slide, please. The next slide we can see, and this graph is very, very interesting. We'll see here that in terms of e-cigarette usage, there's 471 kids reporting using, and then the ones that they did not use, 495. So it's pretty much the same amount of kids that have used and have not used. That tells you a lot, right? There's 126 kids reported smoking cigarettes, following by hookah with 92, and then pipes at 86%. So it's a big concern that kids are really trying these products and getting addicted to it. Next slide, please. The next slide talks about access, and this is why it's so important to have a very clear ordinance that works on enforcement. We see in this slide that 20% of kids get their tobacco products from convenience stores, right? The blue part. Then 18% get those products online. 22% from vape shops. You probably have seen those smoke shops, vape shops in Chula Vista all around town, right? We have addressed that in a few presentations at schools. And then sadly, we're seeing that 40% of kids get these products from either family members or people that they know. That's the need of educating and bringing awareness about this problem, because these kids, they will go with their older brother, they might be using their parents' electronic devices. So there's that need of educating people about it. And then the last slide, it talks about those kids who vape or smoke, who wants to quit, right? And 59% of those kids stated that they wanted to quit smoking or vaping. The next slide shows you, can you keep clicking next? Because we have some information there. Brendali, please.
Before or after?
Just keep clicking like you're going to the next slide, and you'll see what's that right there. Thank you. Go, go, go. There's 2 more clicks. Thank you. That's enough. Okay, go back now. Okay, so here, one thing that we recognize is the industry has done an amazing job in getting these problem on table, right? And one of the things that they do is they invest millions of dollars in their products. And these last 10 years, they have done that using technology. As you can see, the jewel on the left looks just like a technology piece. They actually hire some engineers or some designers from Apple to do these products, right? And they also did a lot of research about nicotine. So they came out with salt-based nicotine now, which basically they add salt to that, and that absorbs faster and then gets kids more addicted. The product not only has that issue of design and nicotine, but also the amount of nicotine in these small devices are a lot of stronger. So if you see the left side, you see the jewel. It's a tiny little USB port look like, right? And on the right side, you see a tank with free-base nicotine. Those tanks are very famous. Kids, they do a lot of tricks with that. There's a lot of smoke that produces, but it only has 25 milligrams in comparison with 41 to 68% milligrams of nicotine that jewels or puff tarts have. Next slide, please. The impact of social media. The industry has been so smart. They're applying all these millions of dollars on media, but they have done all these social media platforms where they share with kids, and kids can buy the stuff. If you see on the bar in the center, it says there's kids selling to other kids, right? And there's offers. So 1 puff bar for $10. If you buy 3, there's 25, and that's how it goes online. Next slide, please. The tobacco industry has been well known for the last 100 years to market, right, to everyone, but they have also took advantage of low-income communities or people of color. They have heavily marketed to African Americans, to Latinos, to American Indians, and you see the percentage here. This is a problem with health equity, right? So 70% of African American smokers, 42% of American Indians are smokers, 33% of Hispanic Latino smokes, in comparison with 18% of white smokers. So that is a quote on the bottom about the industry and what they basically think, and that's basically we're gonna get these people addicted. Next slide, please. Here are some other examples of how the industry takes advantage of current issues that happened. On the bottom, you see on the left side a picture of this young woman with a blue e-cigarette. This piece of marketing came out right after the Parkland shootout, like about a month later. If you remember, Emma Gonzalez was one of the activist students for gun control. So within a month, they came out targeting young women. And then on the right-hand side, we see another piece where they use that same image of Ariana Grande. So they use these influencers or these images that, to influence kids to smoke. And again, they invest millions of dollars in developing these products. You see on the left, you see the Soren, you see Juuls, you see other products, electronic products. Cynthia, would you like to speak to Young Brains and Nicotine?
Sure. Totally. Okay, so the reason why our youth are being targeted so heavily with the flavored products and on social media is because the industry knows that they need to hook them while they're young. If they wait until they become adults, then their brains are not as likely to become addicted. Young brains are still developing, right? So as a human, our brains aren't fully developed until our mid-20s. when they're in adolescence and those hormones are kicking in and all of those synapses are building in like rapid succession, if we interject a addictive substance like nicotine, those synapses adapt to that so quickly. So then they're more likely to become addicted faster. They're more likely to use more nicotine and have a more difficult time quitting, even if they want to, like we saw in that earlier graph. It's a very big deal. So that's why policy is in place so that tobacco sales shouldn't start until the age of 21, knowing that this is the science behind it. However, our youth are being targeted relentlessly by products and by marketing by the industry. That's why we really want to end the sale of flavors so that our youth are less inclined to start. We saw earlier that if they don't have access to flavors, they're not going to use the products. We want to reduce the likelihood of their addiction and protect their growing minds. Next slide, please. Okay, sweet. So how can you get involved in San Diegans versus Big Tobacco? We would like to extend the invitation to Brenda Lee and all of your colleagues to sign a letter of support in favor of ending the sale of flavored tobacco in the city of Chula Vista. Thank you, Manuel. Yeah, and it'd be excellent. What it would show is that you're in solidarity with San Diegans versus Big Tobacco, which includes Say San Diego, of course, American Heart, American Lung, ACS CAN, Tobacco Free Kids, all of these public health tobacco control groups who are looking to protect our youth. Manuel, I think, will send the letter of support to Brenda Lee, and then Brenda Lee, if you're able to distribute it to those on the call today, we would love to have each of your individual organizations. San Ysidro Health, I know, recently signed it last week. To join us as we look to end the sale of flavors.
Yes. And I know that many of your organizations, clinics, and others signed a letter of support for SB 793. So it's basically the same thing. The only thing we're asking for not exceptions. We're really concerned that the city council in Chula Vista and in San Diego, they're going to exempt hookah lounges. Cities like El Cajon has banned hookah lounges at all. There's a huge population of Middle Easterns over there, and the hookah industry, they claim that, right, that it's culture, you're attacking my culture and blah, 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 and that's not the case. But ways you can get involved. We are meeting the representatives. We actually have met with Council Member Salas, with Mayor Salas. She was in support, encourages to meet with City Council. We met with McCannon, who is in support, with Galvez, who is not. She wants to reduce nicotine first and then the flavors, which makes no sense. But that it's very important that we get involved and contact our representatives, because they need to hear from the community about this problem, right? Cardenas also, we met with Cardenas. She's in support, but not with hookahs. And then we are meeting with the in the next in the near future. We're gonna need people to do public comment. We need community support, right? And write letters to the editor. Making a phone call takes you 1 minute to just to ask your city representative to help and end the flavor and all the sale of all flavored tobacco products. That's the main objective, and we are only looking up for youth, right? That's the problem with it. And with that, we want to thank you. Any questions?
Thank you, Manuel. Thank you, Chelsea. Thank you, Cynthia. I'm glad that we had extended time today to talk about this, and not only increasing our knowledge and awareness, but also providing us for ways to support the cause. Certainly, let me put this here. We are in support of these initiatives. I want to go back to the chat to see if there are questions. Let me see. Oh, thanking you for the presentation. Also, more information on connecting with other programs. Thank you, Chelsea, for sharing the web link. More messages on this topic. Yes, very informative. Really thanking you and your team for sharing that today. And again, for those that may be new to this platform, we by the end of the week, we usually upload the recording of the call and also all the materials, flyers, and of the presenters today. Here, Maria Miramontes asked in the chat, I can ask the federal, can you send the forms? Hi, Maria, ¿cómo estás? You're mute. Could
Yes,
you ask the question?
yes.
Okay.
Just going back to the end of the presentation where you say that as an organization to join, and I don't know if Family Health Centers of San Diego is already part of it, but I can ask if if you email me the forms, I can send them to the right person and send them back.
Yes, definitely, and that's what that's what I was going to tell Brendali. If we can contact you, each of you directly, and then hopefully you can check with your agencies to see if you want to sign that letter of support, or you can just sign it, as a community member.
So certainly, Maria, if you want to type in the email address, so
Sure.
Juan and their team can go back to the chat box for any other attendee. If you include your contact information in the chat, they can pull out that information from the chat and double check if your organization has already signed the letter of support. And if not, you can do that as Manuel indicated, as an individual or also as an organization.
So if I do it as an individual, do I have to live in Chula Vista?
In Chula Vista or San Diego. Yes.
Okay. And are you reaching out to schools?
Yeah, we actually we actually are having a resolution signed by the San Diego School District this afternoon, and we're working with the Sweetwater School District to bring this, as I have done a lot of presentations covering for the last 4 years at local schools in Chula Vista and San Isidro and all, Imperial Beach and all those areas.
I have a dad who works at charter school in Chula Vista. I don't know if you are planning to go to each school or school district to. I mean, I know you mentioned Sweetwater, but I believe that I think starting from younger age, kids should be, or parents should be informed.
Yes, we are working with the Board of Education from both the school districts, so that to get a resolution, and again, that's in support of our effort to end the sale of all flavored tobacco products. Yeah, any information you have from charter schools, USD, any school is welcome to come, especially if they're not part of the school district. So charter schools, any agency working with youth, educational schools, all of them. We are looking for support. And if you want to join the actual coalition, please let me know, and I would love to send the information.
Okay. Yes.
Thank you. Thank you for your questions and expression of support to Manuel and the team. This was a very interactive session. I'm glad that we were able to provide this call. And for incoming calls, the next dates are October the 12th, November the 9th, and December 14th. So that's how we're going to close 2021. And if you're interested in presenting about updates on your program, please let me know directly. I want to thank everybody, but there is a raffle opportunity. So let me be able to see the chat so I can get that. I wanted to ask, giving closer to the kickoff of the Hispanic Heritage Month, I want, if you can write in the chat, the Latino country of origin, that you are, and it's just kind of an informal survey of how many represented, how many countries. If this would have been an in-person meeting, we would have had music, right? We would have had food. We would have had some dancing steps, as as it happens when all the Latinos congregate. We have representation from El Salvador, Mexico, lindo y querido, and others. Let me see. Oh, wow. Yeah, Mexico, of course. Oh, we have Vietnam. What? Italy. What else? Peru. Who else is here represented with your banderita, with your flag? Y viva México, claro, claro que sí. ¿Qué más? ¿Quién más está? Who else? Who else? Who else? Who else is here? Well, the raffle question, and if you were paying attention at the beginning of the call, oh, in Colombia, yes, represented by a daughter of a Colombiana here, a son of a Colombiana. Thank you for that and sharing. I wanted to then do the quick raffle before we leave. And the first one that types in the chat, what country of origin is Brenda Lee? I mentioned it at the beginning. Yeah, there you go. It's Puerto Rico. Woo! I've been flashing the mug several times during the. So let me see who was first. Yes, Nelly Gonzalez. Nelly, let me make sure that I have your email address. So I'll send you the tiny gift card courtesy of HealthNet. Thank you, and enjoy the rest of your day, the rest of your week. Thank you so much for joining us today, and we'll see you next time on October 12th.
Brenda Lee,
we have a question on the floor.
Is there what's the website, the partners website?
Yes, it's ChulavistaCC.org. And when you see the tab of partners, you have there always the link to join, a way to self-subscribe. Oh, thank you, Susana, for putting it on the chat box. And also the schedule of calls.
Okay. All right. Thank you so much, everybody.
Excellent. Well, thank you, everybody, for your time. And I'll give you back 9 minutes to your day. Have a wonderful Tuesday.
Thank you.